Hi, everyone. My name is Dr. Davis from the Extraordinary Kids Clinic at Children's Colorado, and I get to introduce this topic today, Get Moving, Strategies for Stimulating Motor Skills and Physical Activity in Children with X and Y Chromosome Variations. I have the privilege today of talking with our occupational therapist, Sid Martin, who will be coming on in a few minutes after I introduce the why you should care about what we have to say. And Sid is going to talk more about how you actually make it happen. All right. So I'm going to do this kind of TED style talk with a few highlights and take home messages. So my first take home message on this topic is that X and Y variations are associated with some, unfortunately, negative impacts on health. We know that there is a host of things that we can see have an increased risk in X and Y variations, and a lot of these are associated or can be modified by physical activity. And if you want to hear more about these particular medical topics, come to the Beyond the Hormones talk on Saturday to hear Dr. Tartaglia and I speak more in detail about these. Point number two is that genetics are one of many factors that influence these health and these comorbidities. So we know that age also contributes risk, hormones, diet, so the food that you eat, medications or drugs that you might be putting into your body, and then finally, activity, which is the focus of today's talk. Number three is that individuals with X and Y variations may be particularly vulnerable to inadequate physical activity. And I'm going to present here what I call this vicious cycle. So we know some of the things that some individuals with X and Y variations experience include lower muscle tone, difficulties with motor planning or coordination, and fatigue or lower exercise tolerance or endurance. This, of course, then leads to that physical activity is often more difficult than it is for their peers, and in fact, just not enjoyable. However, this then leads to activity avoidance, which then leads to sedentary choices, picking things that are not moving to do in your free time, like video games or other activities sitting on the couch. This then further leads to deconditioning. So you become more and more out of shape. And then this makes physical activity more challenging as well. This also leads to more cardiometabolic risk factors, which are a host of conditions that put you at higher risk for developing heart disease and type 2 diabetes and stroke later in life. And I think I'm going to propose to you that daily physical activity is the way to intervene with this vicious cycle. So that comes to point number four, is to stop this vicious cycle by prioritizing physical activity. And this doesn't necessarily always have to look like an exercise program, like on the treadmill running or elliptical or in the gym lifting weights. This can look like a lot of different age-appropriate things. So in infancy, even encouraging things like tummy time, and even if it's not necessarily enjoyable every minute that they're doing it, encouraging them to build up that stamina for that activity. As they get older, this would, of course, look like different play activities, possibly sports or extracurricular physical activity events. But you can also incorporate a lot of physical activity in family time as well. So going on walks or hikes together, bike rides, walking the dog, active play at the playground, etc. And then, of course, individuals that are in therapy, physical therapy, occupational therapy, might be getting physical activity through that method as well. It's important to know the general recommendations by bodies that establish these standards for that all kids and adolescents should be getting at least 1 hour of moderate to vigorous physical activity every day. And I can definitely guarantee you that that is not the case for most kids and adolescents out there. Likewise, adults should also be getting a lot more physical activity than what they're getting. The recommendations are 150 minutes of moderate to vigorous physical activity every week. And this usually is split into 2 to 3 different intervals or so. Certainly can be split into more than that. I would maybe even offer that because kids with X and Y variations are at a higher risk for these difficulties with physical activity and some of these subsequent medical concerns that we can see that are associated with lower physical activity levels, that we might even need to be targeting higher physical activity duration or intensity with these kids as well. But at the meantime, we'll start with what the general recommendations are. All right, so this was one of my favorite posts on Facebook a couple of years ago. There was a social media post on an X and Y group that said, just pose the question, hey, what sports or activities did you enjoy most when you were a kid, or do you enjoy most now? And these are some of the answers that were in there. I just pasted this all in, and you can create this word cloud with the larger things being the ones that have more responses, and the smaller ones being maybe responded once or twice. Number 5 on my list is to identify and then overcome what barriers are limiting your physical activity, or physical activity from being getting enough physical activity. Sometimes physical activity or environments that physical activity is done in might be overstimulating or social, that they're not comfortable in that situation. And you can overcome this by possibly putting them in smaller settings, or even having private lessons, home or family activities that they feel more comfortable in, or, as I mentioned before, physical therapy or occupational therapy. Another barrier that you might hear or you might have is that physical activity is hard, and absolutely it is hard. And I have evidence from my research that it is truly harder in individuals with X and Y variations. However, just because it's hard doesn't mean it's not good for us. And the more you do it, the easier it becomes. Practice and repetition. Also recognizing that it might not be the same as other peers potentially, and wherever their level is should be appropriate activities that are targeted for your kids or yourself. And then also really encouraging with positive reinforcement. So yes, it is hard, but really being recognizing, hey, I'm doing this hard thing, and I'm better because I'm doing this hard thing. I will also hear the barrier that I just am not motivated at all. No motivation from the individual to get up and move. And I definitely understand this and hear this. I think that having it as a regular schedule helps with everyone. So it's something in the schedule that you do all the time. There's either a physical trainer or a physical therapist or a trainer that you're meeting with, or you're having a scheduled appointment or date to do a walk with friends, or you are having targeted time there's activities that are happening at home that cannot be on electronics. Another barrier I hear is that, I'm just not good. I'm not good at running up and down the baseball court or the basketball court. I'm not good at coordinating the soccer kicks. And I really encourage kids to try different things, or adults to try different things. You're never too old to try something, and you can find something that you like. There are certainly lots of non-competitive options out there. You don't have to be on a team necessarily to enjoy sports activities, for example. And also just really encouraging you to do your best, and whatever that looks like that is good. So stop the negative talk. We also hear a lot about fatigue. Again, come to our the medical session that's more than just hormones. We talk a little bit about fatigue in there. Then getting enough sleep is obviously important, and recognizing that fatigue is something that a lot of individuals with X and Y variations struggle with. I think that it still is important. Again, just because it's harder doesn't mean it's not good for us and we should do it. Also making sure that there's not any other medical complications that might need to be treated to address fatigue. Down on the bottom here, we have anxiety or inattention. So sometimes this means, like, if they're, on a sports team, for example, or put in even a toddler class, sometimes I hear that they're just not able to pay attention the same way that their peers are. or that there's anxiety with they don't want to go into that group. They're just too shy, too scared about the situation. And I think also all of us can be prepped for new situations, and maybe, explaining how to play the game before you're throwing them into the situation, and to try to figure it out on their own. So really kind of playing or role modeling what that might look like. Also communicating with the coach if you know that your child has vulnerabilities that they might need to address. And then sometimes these things can be addressed by medications as well, depending upon how they're influencing other areas of your life. Then getting into more of some of the family barriers. Time is always a barrier for all of us to do things that are taking care of ourselves. So again, making it part of your schedule. For kids that are involved in that have a lot of homework to do after school, making sure that you can actually incorporate some of this physical activity as part of their work, with breaks, so homework breaks that involve physical activity, even if it's just short bursts of physical activity, both gives them a little bit of a mental break and also serves the dual purpose of getting their heart rate up a little bit and getting them some physical activity. And then if your weeks are truly packed with all things activities that you really can't get in more physical activity, really making sure that you do plan weekends to be active. And then finally, thinking that, I have too many other things on my plate right now. We're dealing with things at school and doctor's appointments and behavior at home. And, this exercise thing, sure, it might be important, but it's not important at this moment. I think that I encourage you to reevaluate priorities and understand that a lot of the things that physical activity is helping with might be kind of hidden behind the scenes, and you might see that there are numerous benefits that you didn't even expect if and when you do make getting enough physical activity a priority for your kid and yourself. And with that, I'm going to turn it over to my colleague, Sid Martin, who is going to actually tell you how to practically do this and make it a little bit more fun.
My name is Sid Martin, and I'm an occupational therapist at the Extraordinary Kids Clinic at Children's Hospital, Colorado. And I'm here to talk to everyone today about physical activity in children with X and Y chromosome variations. And so let's find some ways to help get moving to get more active. So we'll be talking about some activities to improve physical activity and hopefully some fun ways that you can engage your kiddos and to help support movement and just overall health and wellness. So when we're thinking about the benefits of physical activity, we know that strength and conditioning is really important. And we're thinking about our core trunk strength and what we can do with that, and how our physical strength in our trunk and core makes us have stronger arm movements, makes our legs stronger, those kind of things. And then that in turn helps us with our endurance to be able to become more physically active. One of the things we know is that when kids play, whether they're whatever age, they do so through social activities. And a lot of times those social activities are sports, right? And so we notice that if you have troubles with your coordination or your strength, or you fatigue quickly, something like that, it often impacts you socially. So that's why we really want to work with our kids to help develop that and make it more easier for them to engage in these activities. We work on coordination, so balance and bilateral coordination, and then we also work on those leisure activities. And physical activity really does help your sleep. It really can help your mood and your behavior, and as well as just give you that overall health and wellness that is we're really looking for as well. When looking at gross motor strengthening activities, again, we kind of talk about that big core trunk strengthening or shoulder stability and what we do and being able to have that postural control. And I'm sure you guys have heard about that. with therapies and things like that, we really need that strength to come from the midline, to go out to the limbs of the body, those kind of things. And it helps with balance and coordination. And then we also are really aware that our kids have that fatigue factor. And that's really important to note. And if you have weakness or global trunk weakness and gross and fine motor weaknesses, that will impact your ability to engage in longer sustaining activities. And then that also impacts the muscle mass, which Shanlee will be talking about a little bit later today. So we know that physical activity, we need to have about 60 minutes of physical activity daily, if you can. It seems like a big ask, but that's kind of what they recommend. But I like to break it up into 10 and 15-minute intervals. And it's really important to make it just part of the daily routine, right? It's just, this is our time to do it. Let's go do 10, 15 minutes, or even start out with a couple minutes and do 5 minutes or something like that. We want to do 3 different types. We want aerobic, bone strengthening, or muscle strengthening activity to support engagement in those activities. When we're looking at strengthening, I have included that perceived effort scale, and that's one to just figure out what is the perceived ability of what I need to do this exercise. You might use that with your kids because they might think that what you're asking them to do is like, number 10 up there. So, kind of put that together and figure out how difficult the activity is that we're asking them to do. One fun thing to do is to put your hands on the chairs and just do chair push-ups like this. And that's pretty fun. Another one to do is sit to stand. So they're just going to be in a regular chair and just stand up and down and do that one for a minute and count how many you got. See if you can increase your time. Those kind of things are really fun. We also like to do wall push-ups. And then a lot of kids really like to dance. So don't forget how dance can be a great activity. They recommend for kids ages 3 to 5 to just play. And then the older kids, we want to have them engage in moderate to vigorous intensity of aerobic activity, and then to do that vigorous intensity activity 3 days per week. And then they also are recommending weight-bearing activities 3 days per week. So you can start small and just slowly increase the time. I think that works really well. Some fun activity suggestions that I have is a scavenger hunt, right? And then you could maybe carry a weighted backpack while you're doing that, and that makes it more easier to do. Laser tag, capture the flag, some flashlight activities are really fun. And we also have some, if you look at YouTube, there's a million things on YouTube that are exercise related. Coach Wood has got some great ones. And there's some yoga things with Cosmic Kids Yoga, as well as the Kids HIIT workout. So moderate intensity exercise is brisk walking, swimming, or biking. And vigorous intensity would be that sustaining that exercise for 20 to 30 minutes. And we always want to try and start the exercises with stretching. We do know that our kids have tight heel cords, and that's a tough one. So go ahead and begin with that before you start exercising for fun. And some additional workout resources are fitkids.org, which is a really good one. The Kids Bop Daily is a really fun dancing YouTube video, and they just have multiple ones that you can keep using on and off and see what your kiddo likes. And then some sport activities that are single sports, you don't have to have a team to do them, would be golfing, swimming. Basketball is a team sport, and then taking a hike and doing some dance, or just hitting the tennis ball against the garage door, things like that work well as too. So because we know that our kiddos love Minecraft, I found a Minecraft workout. So there are a bunch of them. Just use it. I think as long as you get that motivation and that drive and that interest level to engage in the exercise, and if that's the thing that helps your kiddo to do that, I say go for it. There is some really good fun apps called GoNoodle.com, and they have a bunch of different things from self-regulation breathing up to exercise and dance and things like that. And 4kidsplus.com is a great one as well. So you can enjoy those. This site is really, really excellent. It is made, it's a site that a father made, and he has a son with the diagnosis of Prader-Willi syndrome. And exercise is really important for those individuals that have that diagnosis. So he built this website and built this company, and it's called Let's Go Fitness. And what they do is you can sign up and do an individual membership for your child, and they will take you through a personal trainer, some videos to get you going for how to exercise and to get that more buy-in with it. What also is really cool about this company is that he understands the importance of our kids learning to teach others that have a disability how to exercise as well. So they actually employ kids that really think that exercise is their thing, and they want to do a video themselves and then, you know, jump online and teach other kids how to do that. So even though it was designed by a father with a child with a different diagnosis, I think they're open to other diagnoses too. I saw some individuals with Down syndrome doing things there, and that might be something really fun to try as well. And thank you for watching. This was, and my name was Sid Martin, and we will open it up for question and answering. And then you also will be able to see Shanlee Davis share her part of this presentation as well.